Hi, I'm Lisa at Optimum Health, and I just wanted to do a video, a quick-ish video, about something that comes up a lot when mums come in to see me, and that's this ongoing issue of back pain or back discomfort or anything like that. So the first thing to say is that if you do have any niggles, discomfort, aches, or even pains like this, it's very important that you do get them checked out. Don't accept them as being just one of those things or think it's something that will go away or you're too busy for at the moment. Get it checked out because there is stuff that you can do, and if you can alleviate that, that makes a big difference to your quality of life. So let's have a look at some of the areas that can contribute to that backache and discomfort. So let's start with a core, and that means different things to different people. So I'm going to talk about 4 elements in particular here, and that's the diaphragm, the abdominal muscles, your pelvic floor, and then there's the muscles that go down the spine or either side of the spine and cross over, and there's all sorts of intricate stuff going on back there. So talking about the diaphragm, first of all, that sits in between the ribs there and moves up and down as we breathe. The thing is though, as our bump and baby grows with pregnancy, that rib cage can be pushed forwards and up, which can inhibit your diaphragm. Plus, as it's pushing up, it kind of restricts how far your diaphragm can go up and down. So sometimes we do need to focus, or most of the time actually, we need to focus a little bit on just breathing in that postnatal period to really get that diaphragm moving properly again. Why will that make a difference to your back pain? Well, it's a key element of your core. So if it's not able to move freely in a good position, then you're not able to transfer load effectively and move efficiently. And so that can manifest itself in terms of aches and pains elsewhere in your body. So looking at your abdominal muscles then, and particularly here, the six-pack muscle. Now, it may not feel like it at the moment, but there is definitely one under there, and it comes in 2 halves. And in those later stages of pregnancy, to make room for baby, as your belly expands, those 2 halves can separate, and that's called a diastasis recti once it gets to a certain distance. Now, all things being good and equal, once you've had your baby, in the course of time, those 2 halves will move back together. The thing is though, we as mums and modern mums are required to get on with stuff pretty quickly after birth. You know, if you do have your baby in hospital, you're sent home quite quickly. If you have a home birth, then again, you're back on the job straight away. So if you're not getting the rest and recovery you need, that can sometimes inhibit the healing of that gap, and many other factors come into it as well. The key thing is though, if you do have a significant gap down the front and you're unable to create tension through that gap, then that can also contribute to low back pain. Is there something you can do about that? Absolutely, we'll come to that in a minute. So the other key element then sits at the bottom, literally, your pelvic floor. Okay, so that has carried the weight of everything that goes with your baby, plus your baby during pregnancy. Then it went through a fair old event during childbirth as well. So it needs nurturing and recovering. Okay, so there are exercises that hopefully you were given to do post-birth that related to closing and lifting the pelvic floor and then releasing and relaxing it as well. And being able to do that is a key element to preventing low back pain, but also it's then about getting those to work together. Can't seem to do that on a camera, there we go. Okay, but getting the diaphragm and the pelvic floor to move up and down, synchronizing effectively with those abdominal muscles as well, because again, that allows you to transfer load through your torso and move efficiently without drawing on those back muscles more than you need to. So let's come on then to alignment. So during pregnancy, your alignment changes because you've got this big weight out front here. And then obviously once you've had your baby, you're carrying in front here, whether you're breastfeeding or bottle feeding, all your movements tend to be out front. And so what that can do is cause us to round through those shoulders. So if we're rounding through the upper back, it means that we can't maintain the natural curves in the lower back. So again, this can lead on to back discomfort. It might also cause some shoulder discomfort. So can we address those alignment issues? Absolutely. It's not about being in perfect posture all the time. It's dynamic. You're moving. Let's face it, as mums, you don't get to sit still for long. So it's, again, looking at ways and cues to give you to be in the best position possible most of the time. Which leads us on to the muscles down the back of our body, or the posterior chain. So here we're looking at the muscles around the back of the shoulders, down the back, particularly those buttocks though as well, and getting those buttocks really firing for simple things like getting up out of a chair, squatting down to then pick your baby up. So making those muscles work, but also in conjunction with all those elements of the core that we just talked about, is again a great way to get you strong, get you recovering from the whole pregnancy and childbirth event, but also to reduce the incidence of back discomfort. So that leads on to also the fact that as a mum, you are lifting every day. So whether that's picking your baby up from the floor, up from their cot, in and out of their pram, putting them in and out of the car. Then as they get bigger, obviously that weight increases, so you're lifting a bigger weight from different heights into different positions, and let's face it, they can be awkward. So again, if your lifting technique is not spot on, it can be very, very easy to put a lot of pressure through that lower back and through that pelvic floor as well. So having good lifting technique is worth its weight in gold to a mum. So all of these elements we look at in our postnatal restoration and recovery course, along with a whole load of other aspects like your nutrition, like your stress management, like looking at your gut health and how it affects both you and your baby. So if this is something that you're interested in, whether it's as part of your restoration following pregnancy and childbirth, and whether your baby is a few weeks or several months or a year old, it's all still relevant if this is how you feel. But particularly if you are getting those aches and niggles, come along. We can check for that diastasis recti. We can give you strategies that are specific and relevant to you and that you can fit into your routine around your baby. So click the link at the end of the video or down in the comments there for the link to the website with full details of our next course. And I hope to see you soon. Please feel free to fire in any questions as well. I'm always more than happy to answer questions. All right, thanks for watching. Speak to you soon.